Why? With the atrophy, a lot of the times comes the weakening of the ankles. We know that more people fall and break their hips due to weak ankles. We have the balance issues from sitting. So doing something as easy as sitting in a chair or standing and strengthening your ankles can help. Posture. When we've been sitting in a chair for a long period of time, our shoulders start to move forward, our back stretches out, our neck becomes very sore. This forward posture or protective posture that we're using when we're sitting is also what we're using when we're biking, when we're eating, when we're driving, when we're moving forward. The shoulders become very round. So it's very important with proper posture to be able to sit up, which will also help by bringing the shoulders back, help the breathing, and help your digestion. Reducing blood pressure is another major problem, as well as decreased stress, tension, and anxiety. Mental and physical relaxation is so important and so difficult when you've got the tension, stress, and anxiety. Improve sleep. Sleep is so important to our bodies that we need to be able to do it. And we know with fatigue especially, all the sleep in the world is not going to make you feel better. But the sleep that you get after you've been exercising and after you start a program will help improve that sleep that you're getting. Injury prevention. By being stronger and having more mobility, you're going to make your body respond a lot quicker, which can help with any injuries. Decreased risk of other diseases, such as obesity, diabetes, coronary artery disease, osteoporosis, and high cholesterol. Now, with osteoporosis and chemotherapy, new studies are coming out showing that osteoporosis is a problem after chemotherapy. So with exercise, not only upper and lower, can help with osteoporosis. So by exercising, people are able to keep their muscles in shape, which will make everyday activities easier, help maximize their independence, and help them to maintain a level of function within their medical limits. Again, it's only what you can do. Not to push yourself, but to start that little bit of positive cycle of a little bit today, a little bit more tomorrow. Physical exercise can also produce secondary benefits, such as an improved state of mind and mood. You feel better. We know that. Increase your self-confidence, decrease depression, and a higher level of physical independence. Exercise will also help prevent problems that are associated with immobility, such as stiff joints, poor appetite, and constipation. It is important that clients only exercise as much as the condition allows. So when you go to the doctor and you say you want to start an exercise program, you have to remember, depending on your ability, not somebody else's, but your ability, is that's how much exercise you will do, only as much as your condition allows. Exercising should begin slowly with a warm-up. You want to get the blood flowing into the muscles. So for some, this is just starting your walk slower and then gradually making it a little bit faster. If you're going to be doing weight training, make sure your body is warm first. Go for a little walk and then come in. Make sure after you increase the mobility of the muscles, you end with flexibility and stretching exercises. Very few people like to stretch, but it is very important at the end of your exercise, whether you're going for a walk or doing weight training or swimming, whatever you are doing, it is so important to end with flexibility exercises, get the blood back into those muscles, and stretch. So we have the benefits. What about the precautions of exercise? Well, people who have gone through or are going through cancer treatment should not exercise until they have permission from their doctor or health care provider. After you receive the necessary permission, there are still many warning signs that you need to watch for. And if any of them come up, you really need to stop exercising right away. There are also treatments that should not be followed by exercise. So if you're exercising, you should stop immediately if any of the following symptoms occur. if you feel pressure in your chest or pain, palpitations or irregular heartbeat, if you have a sudden shortness of breath, if you become very tired all of a sudden, or muscular weakness, if you feel pain anywhere, have blurred vision, dizziness, lightheadedness, or faintness, stop exercising. If you feel hot or you feel pale, if you look in the mirror and you see that you're paler than usual or with a bluish skin, stop exercising. If you become confused or disoriented or have a sudden onset of nausea, please stop exercising right away. It's very important. It's not going to go away. You need to stop exercising. If you feel a rise in your blood pressure or a decrease in your blood pressure or your heart rate while you're exercising, again, it's very important to stop right away. It is also very important not to exercise if the blood count results are in abnormal levels, which means if your sodium or potassium, your electrolytes, are not normal, it is not a time to exercise. Any abnormal protein or compromised immune function. And if you've had diarrhea or vomiting that's occurred in the previous 24 to 36 hours, it is not time to exercise. You need to get your sodium and potassium level, your electrolytes, back into a proper function before you exercise. If you've had chemotherapy or radiation therapy within the previous 24 hours or on days that lab tests have been performed, you should not be exercising. Now, lab tests as simple as having blood removed from your arm for your blood test. You need to watch and be careful. Now, medications can also cause side effects that can cause complications while exercising. We know that some medications can cause fingertips and toes to tingle, which will result in imbalance and not being able to hold things properly. So check your medications again with your doctor before you exercise. So exercises really that can be done seated in a chair. You don't have to join a gym. You don't have to buy a whole bunch of weights. Very simple, seated in a chair. One of the areas that we really need to work with is your shoulder area. This is an area that's very tight, and because of the protective posture and the shoulders moving forward, we want to get the shoulders back to where they're supposed to be. For a lot of people, your shoulders are now attached almost to your ears because you're so tense and so tight and so protective. So we need to drop those shoulders and start with blood flow. So simple shoulder shrugs. Sitting in a chair, a comfortable chair, and when you're sitting in a chair, it's important that the chair is a nice, stable chair, preferably on a carpet, with the back of the chair up against a wall so you will not be sliding back or forth. Make sure that your knees are lower than your hips or even width. We like to have the hips a little bit higher than the knees. Making sure you're sitting on your sit bones. Those are the bones that if you've been going for a bike ride, you come back, you know where they are. Those are the bones you want to be sitting on. That'll help to keep your back straight and for proper posture and breathing. Feet should be shoulder width apart, and your hips, your knees, and your feet should all be in line. So sitting comfortably, shoulder shrugs are simple to do. All you need to do is with the arms hanging at the side of your body, bring the shoulders up towards your ears, and then slowly take them back down so your fingertips are going towards the floor. Nice deep breaths are very important, and if you inhale on the way up for a count of 4 and exhale on the way down for a count of 4, you will find that 4 or 5 of these will help start relaxing through the neck. You're exercising. Shoulder rolls are another great way of loosening up through the neck and shoulder area. I like to break shoulder rolls up, so coming straight up first and then rolling to the back and around, and doing that 4 times. So inhaling up, rolling to the back and down, and then again back up to the back and down. When you've done the back 4 times, move to the front. Get both areas of the shoulder.